Welcome to the Healthcare Success Podcast. I'm Stewart Gandolf. I'm looking forward to interviewing our expert entrepreneur today. Today we will be interviewing Rocco Coniglio. He is founder of Psych 360. Rocco, please say hello and tell us a little bit about yourself.
Stewart, thanks for having me. I grew up in Pittsburgh, PA. Went to school at the University of Mount Union in Ohio. Directly went to grad school after undergrad to Robert Morris University back in Pittsburgh. Got my MBA there, and then got started in my healthcare career with McKesson, working in their medical surgical division, selling into primary care. So took a position with them in the Northeast Ohio area. So that brought me back to Ohio. Stayed there for about 20 years. Worked for a number of medical device companies. Gambro was one of them in the nephrology and critical care space. Medtronic was another in the operating room setting. And then my last and most favorite job was with Spectranetics, and they got acquired by Philips Healthcare while I was there, but spent 4 years there in the electrophysiology, peripheral vascular surgery, interventional cardiology, and cardiac surgery space. And while I was there, I co-founded a behavioral health company with my wife, Nicole, who's a clinician. And we provided psychiatric med management services to long-term care communities. We grew that company to a private equity exit in August of 2022, and then stayed on for 18 months post-acquisition as president and chief operating officer of the broader organization.
Very good. Excellent. And so the reason why I thought it'd be fun to interview you today is we work a lot, as of course, as an agency with all kinds of different healthcare entities, but especially disruptors. And certainly the world of private equity is not new to us. A lot of the clients we see are private equity backed. And so I think it's a really interesting topic to talk about today. Again, particularly creating something new from nothing and creating a disruptive business that finds and fills a niche. So the first thing is to beyond, and thank you for the background, by the way, but as talking about Psych 360, tell us about the opportunity that you saw in the marketplace, because I think so many great companies start with something new and something different. So tell us about that and how you can do it.
That's a good question. And I'll be honest, it wasn't an opportunity that I saw. It was an opportunity my wife, Nicole, saw. She is an acute care nurse practitioner as well as a board certified psych mental health nurse practitioner. Mostly, the beginning of her career, she mostly worked in the hospital setting, much like I did. And then when we started having children, I have 3 little girls. My first that we had really changed how she was thinking about her career. And so she took an opportunity in the long-term care setting because it gave her more flexibility. She wanted to be a little bit more present. And as she was providing mostly primary care in that setting, what she noticed was a lot of mental health and psychiatric issues in the patient population that she was seeing in that nursing home setting. And there was really no specialists, or there were very few specialists available to that particular setting for the patients. And she came home one day, and at this time I was working for Medtronic, and she said, this is an opportunity I see. What do you think about going at this together? And I said, yeah, let's do it. And she says, well, I got to go back to school and get board certified in psych mental health before, we can do this. And that's going to take another 2 years. And I was like, sure, why not? She had been in school for like 8 years at that point. So what's another 2? And I said, you should have just been a doctor. And so, she followed through with it. And as soon as she graduated, and it was May of 2015, she got licensed in July of 2015, which is when we started the company, and we had our first couple of contracts in August. So we did have some runway to prepare. And yeah, I mean, that's really how it all kind of came to fruition.
I'm really curious during that period, and before, because that's a long runway before you even begin the business, 2 years of more school. Did you talk to anybody, any skilled nursing centers or anybody at all to, sort of pressure test the idea? Because it's a big commitment before you even got started.
Yeah, I think she had enough experience in that particular area over that course of time, that she knew that there was a need there. What I did do was I looked for a scaled concept, and that was one of the things. I think some people look at ideas and they say, well, if someone else is doing it, is there an opportunity? Is there really an opportunity for me to do it? I looked at it as, if someone else was doing it, then that provided a little bit more support for substantiating the need. And there was a company out there called Med Options. They were out of Connecticut. They were primarily at that time, that was back in 2013, 2014. They were maybe in 7 states on the East Coast. And it was enough where I said, okay, there's a scaled platform out there providing psychiatric care in the nursing home setting. They were primarily doing a lot of it through telehealth, but it gave me more confidence that there was something there. And really, the approach that we took was, we just took kind of a baby step approach. We just said, look, if it's just the two of us, that's fine. If it's just some extra income, um, we didn't want to get ahead of ourselves. I mean, we knew we could scale it. We knew there was the potential there, but there's all kinds of obstacles in the way before you can get to scale. So we didn't want to talk about, growing something nationwide and getting to that point right from the get-go, because I think that can start to overwhelm, when you start a business.
It's funny. I love that concept. And one of the metaphors I heard many years ago was, when you start a journey, you can't wait for all the lights to turn green. There's going to be stop signs along the way, and you just have to get started because you definitely can plan on getting stop signs. And so there's no ideal opportunity. There'll always be changes and challenges. So just a fun fact. But
That's a great metaphor. I mean, I completely agree with that. And I think that's a hindrance for a lot of people that, want to do something like this. It's like, risk and, well, is it gonna, they want some type of a guarantee, and there is no guarantee. The only thing that we could guarantee is that, we're gonna work really hard. We're not gonna give up. And honestly, that's the best recipe for, making sure that something is successful. If you can look back and say, well, we did everything in our power to, make something work out. And if it works out, great. If it didn't work out, at least, you could look back and say, well, it just wasn't meant to be. And, you got to move on to the next thing. And, there's always little failures along the way of success. And, I don't know that I've learned a whole lot from success. I've learned a lot from the failures that have led to the success.
great. It's never easy, is it? I would,
No.
I know you had a sales background, and your wife, I'm assuming, handled most of the clinical, particularly in the early days. Was your sales background helpful, and how would that?
Yeah.
There's a lot of salespeople out there that might have some great ideas. How was that applicable to you?
Yeah, it was absolutely helpful. I sold most of my career. I mean, when I was at McKesson, I sold. They put us through training early whenever we got in there. So it was like formal sales training for 6 weeks. When I was at Gambro, they had a really extensive sales training program. Um, and it was, both McKesson and Gambro used what, a Miller-Hyman model, which is conceptual selling. And that was something that was kind of drilled into me. And then, Medtronic, obviously, top tier organization in the medical device industry, very, sales driven, very much a systematic approach, and very similar once I was at Spectranetics, as well. And, I think that that background, and this is kind of talking to other entrepreneurs from different backgrounds. I've spoken with, there was one recently that I connected with who was an engineer, and he said, I can figure out a lot of, I can solve a lot of problems being an engineer, but kind of was hesitant around, well, I really don't know how to grow a business. I don't have a sales background, and I wouldn't know the first thing about how to do that. And so we just started to talk about some things, and I said it's no different me having a sales background and I'm not an engineer, or me having a sales background and I'm not a CFO. Um, but my financial acumen is pretty good, and so I can certainly work alongside a CFO. And you just have to know where you need to bring in talent to augment where your strengths are. You can't be strong in every single aspect. And I think that for me, the sales background that I had was, I had really good training, had really good systematic approach, and had good ability to convey what our value proposition was. And really, when I was selling, I mean, I got to the point where, I'm selling to cardiac surgeons, or, some of these physicians that are just genius level, and you can't BS these guys. Like, you've got to have your stuff in order. You've got to know your clinical approach. You've got to be able to answer really challenging questions, and a lot of times you've got to answer those questions while they're doing a surgery. So you've got to be on your game there, and so that, I think that helped me tremendously, just to be able to do a lot of things on the fly or sell under stress, and then also just being a part of some of those organizations. It allowed me to build a sales team once we got to the level where we could start to build a team out so that we could grow the business. And we took a pretty systematic approach to that as well, to make it operate like a machine. Stewart, you're on mute.
Thank you.
Yeah.
You get in sales, there's so much rejection with that job. I think that may have helped you too, just helped you outside, because there's so much rejection. You just keep moving forward. So I think that's really intriguing.
Yeah, I would agree with that. I think a lot of what you do as an entrepreneur, uh, you get rejected a lot. And whether it's raising money, selling your concept, selling to customers, clients, getting comfortable with no's and rejection is, I don't think anyone ever gets completely comfortable with it, but the more comfortable you get with it, I think the more you can expand your horizons, and take some chances and take some risks, and not worry about what people think about what you're doing, or how you're doing it, or if you're going to be successful at it. Because I think that's part of the obstacle, and a lot of people, like, in their way, when they think about how am I going to do this.
Yep. So we today we're really talking about entrepreneurship, which I love. The idea of entrepreneurship always. It always seems easy on the back end, but you kind of alluded to this a little. It took some courage. Is that just hardwired in you, or how did you guys, the two of you, get the courage to even do this? That's a monster task to begin a company out of zero. And was there something special, or just was
I
that
think
so exciting?
I think there was a little bit of ignorance to it. Like, it just, um, you know, part of it was, we were both at the point in our careers where we wanted bigger challenges. So I think that was one thing that we had a hunger for, and climbing the corporate ladder it wasn't really an exciting prospect. So that was another component, and the other thing was, I learned that you're never gonna you're never going to create real wealth if you don't own something. Doing the W-2 approach where you're employed and, you're collecting a paycheck, you can certainly have a great life and you can certainly be comfortable, but I was more interested in, if I'm putting my full effort into something, I want some ownership stake in it and meaningful ownership. And that's what entrepreneurship could provide. And so we said, we're going to take that leap of faith. And I would also say that, if I would have known all the challenges that we would have faced in the course of the time that we had the company, I don't know that we would have started. So that's where the ignorance part comes in. It's like, part of it is just being ignorant to the fact, or maybe just taking a mindset where you can't think about the accumulation of all the challenges that you're going to face over the course of the time that you're running a business, because that can be daunting. It can just be overwhelming. We were serving nursing homes during 2020 to 2022. I had never seen a pandemic in my lifetime. I could have never predicted that we would have been on the front lines of COVID and having to manage through that. That was an extraordinary challenge.
And so would you say that was the biggest challenge? We talked a little bit offline about the various challenges of being an entrepreneur. And so, new concept, giving up the corporate job, pandemic, any other challenges that stand out, or what would you like to expand upon?
Yeah. I mean, there's tons of challenges. When you're going from zero, there's entrepreneurs that found companies. So they start from zero where they have no revenue. And then there's entrepreneurs that get into entrepreneurship through acquisition. And so those are two different approaches, but I can say that when you go at it from zero, where you're starting it from nothing, you have to learn how to wear a lot of different hats, because you got to play a lot of different roles. So you've got to play the role of HR, you've got to play the role of talent acquisition, you've got to play the role of finance department, sales, just administrative work, general management. There's a lot of hats that you've got to wear, and so there's a big learning curve in a lot of those things, because no one's ever going to, it's rare that anyone's going to come to the table and have all those skills, but you also don't have the money to pay all of those people. So you've got to figure out a way to work those things. So that's a big challenge. And the only way to do that, in my opinion, is make sure that you have really good advisory people around you and resources, so that you're never going to have all the answers. So you've got to find resources that can help you get the answers you need, so that you can make good decisions as the company grows. And finding money, traditional banks, also, alternative financing, or alternative, ways to raise money. All those things were things that, we had to learn along the way in order to fund the company, bootstrap it as much as we could, preserve as much equity as we could. And then, it was a service-oriented business. So our product is our people. And so with the more people, the more people-oriented problems you have to deal with. And, so it's solving for turnover, solving for culture, solving for, how do you attract talented people when you're a small company and you're competing with large companies that have all kinds of benefits and, packages that they offer that are more attractive. So, those were challenges. There were plenty of times where, in order to meet payroll, because we were growing so quickly, we didn't pay ourselves. Going a substantial amount of time without a paycheck, a lot of people can't do that. So that's part of reinvesting in the business and part of taking on that risk making sure that you're putting everybody on the team ahead of yourself. And so I don't think anything stands out more than COVID, but there were plenty of stress points in the business where, you're losing a large customer, you're having to make up ground, you're having to, raise additional capital in order to support the growth of the business. And, frankly, one of the other most stressful times is just selling the business. I mean, exiting, that was probably the second most stressful thing that I did while we were running that company. That was very difficult.
So we'll come back to that actually. It's funny, the parallels in starting a business. Everything you brought up, I've faced in my own business where, the funding, no paycheck, people problems, regulatory issues, um, all of it. It's just, I think it's part of the game. And as we're talking about entrepreneurship, I would just say that, what I've noticed in listening to you is, and I think it's really true for our company, and really every entrepreneur I know, is the one is to pivot and just jump in. Like you kind of have to, one of our jokes is for those of you who've seen Butch Cassidy and the Sundance Kid, where they just jump off the side of a cliff because it's either that or die. And my joke is you kind of have to figure it out on the way down. Like you just have to do it. You can't
Yeah.
not do it. And so I'm really fascinated by entrepreneurship, and particularly with disruptors, which is of course why we're talking today. So you've already talked about a lot of the things in your journey, but is there anybody, so if somebody's sitting there, they may have an idea that they'd like to pursue, but maybe they haven't gotten off the ground yet. And, what other advice would you give them to build not just a business, but, especially our audience here, a disruptive business, something that's brand new? Can you think of any, or broadly just a business in general?
I think when we looked at our business, I would say there was definitely, at the time that we started it, it was definitely a little bit more disruptive than I think on the surface people would think, because most businesses that were in that space primarily were physician run, and they were primarily physician driven, and the providers were mostly physicians. And so part of the challenge in behavioral health is that you have a very limited number of psychiatrists. And, frankly, long-term care, like going into nursing homes, is not the most attractive place to bring physicians in. They would typically gravitate more towards inpatient work or outpatient clinics. So, recruiting them into that type of setting is challenging in and of itself. And then when you look at the economics of it, what you're getting reimbursed from insurance companies, the pay rates that psychiatrists now have, that is a very challenging math equation to be able to solve for. So what we did was we said, we're going to use exclusively psychiatric mental health nurse practitioners. And I think there were even less of them at that time. But given that my wife was a nurse practitioner and she was, board certified in two different specialties of acute care and psych mental health, I think that gave us an advantage to be able to say, it's a nurse practitioner driven company. And those NPs that wanted to be part of an NP group that was more autonomous, I think that was very attractive to them. And so we created a culture to be able to bring on NPs, create a really good cooperative group that supported each other and that worked very well. And we had very high quality care in the approach that we took. And that was a release valve in the industry, because the pressure that was mounting around behavioral health and the need that was there prior to COVID and then during COVID and then post-COVID, I mean, it just blew up as far as the demand for mental health services. And that was critical to be able to solve the supply part. And you're not going to solve it with just nurse practitioners. You're not going to solve it with just physicians. there's a lot of different routes there's a lot of tools that you have to deploy in order to solve that problem. And so, we had a very successful model, and approach with a fairly large nurse practitioner group that we had built out that was dedicated to psych mental health care. So that kind of answers part of your question on the disruption part. But I think that, if I'm giving advice to entrepreneurs that are out there, honestly, Stewart, I would echo a lot of the things that you had stated kind of in your question to me, which is it is kind of like jumping off a cliff and figuring it out on the way down. I mean, you just don't know what curveballs are gonna fly your way, and there's no amount of preparation. I'll give you an example too. Like, we've been looking at various companies to buy recently, and there was one that I was looking at in the healthcare industry, and I just visited with them yesterday. And you can twist your mind up into a pretzel on all of the things that could go wrong with any business. You can look at it on one side and say, well, these are all the really positive things about this business. I like it. It's generating money. It's profitable. I'm going to go buy this business because of all these different factors that are positive. But then I could argue against myself and say, well, yeah, we have all these positive things over here about the business, but like, here's all the weaknesses. For instance, they have two manufacturers out of China. Well, how do I feel about the manufacturing base in China right now? Do I feel like that's a good thing? Do I feel like there's a weakness there? Do I feel like that needs to be diversified? Is that potentially a massive weakness? I mean, what if there's some geopolitical, instability that gets magnified between the United States and China, and we just buy this business, and so our supply chain gets disrupted, and we just saw that happen over COVID. So there's all kinds of things. You have to just get comfortable with what those risks may be, and say, I'm going to do everything that I can to just do my best to navigate whatever challenges come my way. And it goes back to the rejection piece too. It's like, you've got to be able to, like, when those challenges happen, I mean, for instance, COVID, we could have sat back and just kind of, in quotes, sheltered in place, but we didn't. We actually got more aggressive. And we reached out to everybody we could. I reached out to the president of the Ohio Healthcare Association. I got on the phone with her, and within the first 2 weeks of the pandemic, and was just trying to understand where that organization was seeing everything and how we could help and how we could get involved, and just provide some guidance so that we can provide guidance to our team. I called the lead physician to the governor of the state of Ohio. I found his cell phone number and I called him because I wanted to understand a little bit better. Called him like at 8 o'clock at night. He answered his phone. Spent about 10-15 minutes on the phone with him. Super nice. But I think going the extra mile in a lot of ways. And I mean, look, the guy could have said, like, hey, the hell with you. I don't even know who you are, but you don't know unless you try. And so just getting those bits and pieces of information and trying to bring that back to put a puzzle together, I think is really important. And look, I mean, if the guy hung up on me, I didn't lose anything. But the fact that he answered the phone and we had a meaningful conversation for about 10-15 minutes, it was actually helpful to me. Just to understand how the healthcare world was thinking about the approach that they were going to take over the next few months when everything hit the fan in March of 2020. So, I mean, a long-winded way of just saying that, I don't know that you're going to know or be able to predict like what you have to do. You just got to be willing to do whatever it takes to make it work.
So it's funny, I laugh as, again, the parallels. A couple of things you mentioned, and just to make an observation, ask you one final question. One is, just the willingness to call somebody on their cell phone. A lot of people would stop there. I mean, it's just that constant moving forward, because, that was an important call in the development of your business. If you hadn't been willing to call somebody's cell phone cold, that call would have never happened. So
yeah, that's true.
That's multiply that times a million, little things just like that it takes. And the other part that you said earlier was finding the right people. And I think it's important for listeners to know that, um, like a fun fact with our own company, we have one of our people in our team is an absolute star at operations and organizations and just pretty much everything. And he is fascinated by sort of the entrepreneurial, just, my thing is like, we'll figure it out. And as opposed to like being prepared for a meeting, being whatever. And we need both. Like you need an initiator and you need somebody who can, when you get to a certain size very quickly, you need somebody who can operationalize. So I think the one is to keep in motion, keep fighting, keep moving. That's critical, but that's not enough. And so it's like finding the right people that can execute for you is really important. And, I think that, within our own team, we respect each other's skills because they're, like I couldn't do that. And he says, I can't do that. And, she said, I can't do that. So you have to put it together. And oh, by the way, to make everybody else listening today discouraged, if you don't have those skills, it's hard to spot talent. So it's like there's a lot there. We could do a whole podcast on nothing else. But for the sake of time, you had mentioned the exit process. And so, okay, you've put blood, sweat, and tears. You've had some challenges. Pandemic probably was a great enabler as well as a challenge, right? So it, opened the door for doing things differently and new mindsets. I'm fascinated, by the way, with how business is so different today. We had a beautiful office space, everybody loved it. And, after COVID, I could not get people back with, threats, bribes, love, begging. I didn't actually get any threats, but just nobody wanted to go back. And it's like everything changed. So I think that's a really an intriguing time of year that again we can talk about another day. But the exit process you alluded to as being one of the more stressful times. And you have to tell me everything, but what are some of the things that, you would tell entrepreneurs that, okay, when you get through this finally after this years long process to get there, what are some of the other things to kind of keep in mind on when it comes to exiting?
Oh, um, I think that I'll, I guess I'll look. I mean, everyone's got their different experiences around exiting. Um, as far as mine goes, I think that I would tell another entrepreneur that when you look at who you're selling to, I think that that's a really important measure to be able to understand, who that entity is or who that group is that you're selling to, and make sure that that's a good fit. The economics and the deal structure are extremely important as well. So, how much cash are you getting up front? Is there any rollover equity? Is there any earnout? Is there any strings attached to the deal? And the reason I say that is because I think the more that you can get up front, the better. I think everyone talks about the second bite of the apple and that whole term. I think that's rare in most cases. So I think you really have to understand how you can position yourself to get a really favorable deal done, even if your enterprise value is less, but the economics of the deal or the terms of the deal are more favorable. So, like for instance, if you have a deal where you're going to roll 50% of your equity into the acquiring company versus a deal where you're going to get 80% cash out, but maybe they're valuing you 1 times less than the other company. I think that's probably a deal that you have to strongly consider, even though your enterprise value may be lower, but you're getting more cash up front. And I also think the shorter the transition period that you can negotiate, the better. I don't think founders or entrepreneurs I don't think their mentality for most of them is one that it's healthy. It's going to be a healthy partnership afterwards for a very long period of time because they're used to being their own bosses. They're used to not reporting to others. And I think that that can be extremely challenging for entrepreneurs or founders. And so that's always a consideration. Like, what's the transition phase look like? Is it going to be 3 months, 6 months, 12 months, years? Um, I would I would say that you have to really carefully consider that, because you might not like the decisions that the acquiring company and management team make post acquisition, and um, you might not be around want to be around for those things. So I mean, those are things that I would strongly encourage people to consider um, when they go through that process, and um, and just make sure that you're evaluating those things. I would say that having really strong financial, legal, and and I would even say like an investment banker advisors on your team, as expensive as those as those people can be, um, is I think it's a worthwhile expense, because if you can have more people on your team as you go through that process to make sure that the deal economics are right, the terms of the deal are right, and they're looking out for your best interests, I think they're well worth the spend in order to to protect yourself, but also have a sounding board of other advisors to say, like, well, you might not want to do this, and here's why, and just to challenge you and make sure that you're making the right decision. So those are just a couple points. I could probably go on that particular topic for a pretty long time.
Good. Okay, Rocco. Well, it was fun talking to you. It was intriguing when we talked offline when we first met. Entrepreneurship is something that, I can't really agree with pretty much everything you said today, about the motivation, the to get started, the process, and even at the end. It's interesting when you've been your own boss for a long time. It's hard to become an employee, and so that's material. It's like the deal has to make sense, and like depending on the company, one of the big things that investors look for is this really a company or is this an individual? If it's an individual, that's really tough, because A, will kill
Right.
you, pay you, and B, it means that then you're tied to it. Nobody's going to buy it if it's too much about you. So you've got to create something that other people want to buy, and start with that in mind. And that is not easy to do. So
Well,
anyway,
that's a good point. I mean, I think, if I were to add, an additional point there, it would be that if you want to exit the company, you've got to have some type of an exit plan. And whether it's 20 years down the line or whether it's 5 years, whatever it might be, you've got to understand that you're going to get to a point where either the company is going to die with you or you're going to sell the business. And you want to bear in mind that you're going to get more value out of your business if you sell it at the state, or if you build it to the stage of where you can look at the business can run without you. And you were alluding to this, like if it's an individual that's so key to the business, if one of the owners is so key to the business, it's going to be a really challenging business to sell. Whereas, the businesses that are more mature, where the ownership can be absent from the business for extended periods of time, that tells you something. That tells you that management team that's in place is operating efficiently. That tells you that there's a systematic approach to how the business was built. And I think you get more value for that when a buyer comes in and sees those things and it's apparent to them. So I think that's really important. And I also think that in the evolution of the business, as the business becomes more valuable, you have a very concentrated investment as an owner. And at some point you have to think about, well, how much risk do I want to take? When do I want to de-risk Because if you're, if the majority of your net worth is tied up into your business, so going back to the COVID challenge, for instance, the majority of our net worth was tied up in our business. What if COVID took us out? Like, what if that took us out? We would have had nothing to show for all of the effort and the money that we poured into that particular business. So there's certainly times where you have to consider de-risking, taking some chips off the table, and saying, okay, we've gotten it this far. Let's de-risk. Let's bring in another investor. Let's do a majority recap. Let's sell the business, whatever it might be. But you really have to evaluate that on an ongoing basis so that you can, you can make sure that you don't, so the house doesn't take you out at some point in the future.
I can relate. Well, Rocco, it's
Yeah.
fun working with you today. I appreciate your thoughts. Let's keep in touch, and call me back soon with some more stories of new successes. I appreciate your time.
Thank you, Stewart.
All right. Take care.
Appreciate it. All right.